Good evening, everyone, and welcome to another episode of our series, Prescribing Positivity. In this episode, we will discuss protecting you and your family against the upcoming respiratory illnesses in this fall and winter season. The Office of the Health Ministry of the A.M.E Zion Church invites members of various health specialties to join us and share with our community and congregations. The vision and the mission of the health ministry includes improving health literacy, promoting self-advocacy, and decreasing health disparities in chronic health illnesses such as diabetes, heart disease, and other health disparities that adversely affect our churches and communities. I am excited to introduce our panelists for tonight in alphabetical order. Let's start by introducing Dr. Yabo Beysolow. She is a pediatrician with over 20 years experience in the private sector, a public health professional with prior work experience at the CDC, and currently a public health consultant for the federal, state entities, and local community organizations. Dr. Beysolow was appointed the director of the health ministry of the A.M.E Zion Church in November of 2023. Dr. Beysolow is a wife and mom of 3 who loves to travel and participate in medical missions overseas. Please welcome Dr. Beysolow.
Thank you so much, Mrs. Kent. I'm so happy to be here. Thank you.
Thank you. Thank you. We are happy to have you. And next, we will introduce Nurse Joyce Floyd. Nurse Floyd is the First Lady of Vestibule A.M.E Zion Church in Kings Mountain, North Carolina, where her husband, the pastor, is Reverend Gregory Floyd. Nurse Floyd has been a registered nurse for 50 years with 30 years in public health. She is a graduate of Gardner-Webb University in Boiling Springs, North Carolina, with a Bachelor of Science in Nursing. Presently, Nurse Floyd works as an adjunct nurse instructor at Gadsden College in Dallas, North Carolina, and serves as the Sacred Health Ministry Coordinator for the Piedmont District of the A.M.E Zion Church. Please welcome Nurse Floyd.
Good evening. Hello. Thank you, Mr. Kent. Thank you so much.
Good evening. You're welcome. You're welcome. Thank you so much for joining us.
Thank you.
Next, we will introduce Reverend Andrea Afolabi-Jallah. Reverend Jallah is an ordained minister and registered nurse with over 25 years of experience in the hospital, outpatient settings, and managed care. Reverend Jallah serves as an associate minister at Shaw Temple A.M.E Zion Church and is also on the first responders team. She is currently working in acute care as an alternating charge nurse on the surgical, orthopedic, and oncology unit, and serves as a nurse's aide evaluator and clinical nursing professor at the University of West Georgia, providing consultations for schools, churches, and clinics locally and internationally. As a public health professional, she is actively involved in the health ministry at Shaw Temple, in her community, and on the national level. Please welcome Reverend Jallah.
Thank you, and good evening, everyone.
You are welcome. You are welcome. As we listen to this conversation tonight, please type in your questions, and we will discuss them throughout this conversation. Please share this interview with others, and please help us spread the word. And we'll jump right into it. Dr. Beysolow, what are you seeing across the United States concerning respiratory infections?
Sure, Mrs. Kent. This is just a little background slide to let us see what the CDC is sharing with us on a weekly basis. They have this tool where they can look at respiratory illnesses. And by respiratory illnesses, we mean illnesses that affect your lungs and your breathing. Those are things like COVID-19, flu, and RSV. And so we have this little tool that can monitor what's happening nationally as well as by state. And luckily right now we're at low levels, meaning that there is flu around, there is some COVID-19 and RSV, but not high enough where people are getting sick enough to seek a lot of healthcare. Yes, people are going to the doctor, going to the hospital, et cetera, to seek healthcare, but it's at a low level. We're hoping that it will stay green for the upcoming months, but it could change at any time. So we have the link there where you can check on this yourself, especially if you're planning events, to see kind of where your respiratory illnesses are falling. Then they also have a tool that can let us know how many people are going to the emergency room because of COVID, flu, or RSV. Numbers going to the emergency room for COVID are starting to go down, but we are starting to see more people going to the emergency room to seek care who end up being positive for flu or RSV. So just wanted to share this with you. That's kind of where we are now.
Very good. Thank you for sharing that. And Dr. Beysolow, who is at risk for respiratory infections?
Sure. So when we think about who we should prioritize, right? People who are going to get very sick if we don't get them vaccinated and make sure that we provide them with prevention methods. These are people on the two ends of the age spectrum. We have the older adults, and that's because as we get older, our immune systems are not as robust as they used to be. They don't function as well. So when we come down with a cold or a flu, especially a RSV, it could really knock us down. Mm-hmm. At the other end of the age spectrum are very young children, especially children under the age of 5, because their immune systems are still developing as well. So as a result, they are more likely to end up very sick, being hospitalized because of COVID, flu, or RSV. Then we also have people who have weakened immune systems. Again, your immune system is what really helps to protect you from getting very sick from these diseases. So if your immune system is weak, either because of medication, say, you are on medicine every day for autoimmune disease, say like lupus, or if it's someone who, God forbid, has cancer, is on chemo or radiation, their immune systems are weaker. People with disabilities, and that's only because they are more likely to live, say, in a group setting and also have chronic medical conditions. All of that can place them at higher risk for these illnesses. And then people who are pregnant or recently had a baby are also at risk because, again, they've gone through a lot, their bodies have gone through a lot, and so they're more at risk for having severe complications from flu, COVID, or RSV. So those are the people we really want to watch out for. But anyone, I just want to say this again, anyone can get very sick from flu, COVID, or RSV, not just the people listed here on the slide. So I wanted to share that.
Understood. Reverend Jallah, what are some of the things that we can do to protect ourselves from these infections?
Thank you for that great question. One of the main things that we can do to protect ourselves would be receiving our flu vaccines. We want to be immunized. That's one of the first things we want to do, making sure that everyone receives their flu vaccines annually. We want to also practice hand washing. Hand washing is so important. And also make sure that we are wearing our masks when we're in crowded places. Avoiding people who are sick. If we go into places where people are sick, you want to kind of stay away. Practice social distancing during that time. But hand washing, making sure that you're receiving your flu vaccine, and you're following up with your primary care doctor to make sure that your health is in place.
Yes, thank you for that. About vaccines, Nurse Floyd, can you tell us a little bit more about the flu vaccine?
Yes, the flu vaccine is so important. It is recommended that starting September, by the end of September, people need to really start looking at making preparation to get their vaccine because the flu season is going to start anywhere between October all the way up to April of the next year. Some people will come and say, well, I didn't have a flu shot. We have to start at that moment and teach and let them know that you need to get a yearly vaccine in order to be properly vaccinated. It's so important. Children needs to get vaccines. Children as young as 6 months and older, they need to get a vaccine. And everyone should just remember that not only the younger person, but the older person too, especially if you 65 or older. There's a
Mhm.
new vaccine, well, it's not a new, but there's another kind of vaccine that you can get nasally. It's a nasal spray flu vaccine. And it's for healthy individuals ages 2 through 49. And it's not recommended for the pregnant person. It's not for people with certain medical condition or whose immune system is compromised. I know the nasal flu vaccine at the time when I was working public health, at that time it was a big hit. Everybody wanted the nasal flu vaccine. A lot of people wanted to avoid getting a needle injection, and it's just as effective as the immunization that you have to give IM. But you always want to talk to your health provider about which option is always best for you. Just don't all of a sudden just agree I want to get a shot, because there may be certain conditions or disabilities a person may not can get the flu vaccine by nasal. So always check with the physician.
Okay, thank you. And is it also still important if you have an allergy to eggs? Is it still something that you were not able to get the flu vaccine? Or you have to get one that's a little bit more, that's different, a different vaccine?
I know at the time when I was working public health, that was one of the questions that was on the sheets about
Mm-hmm.
allergies. Recently, when I just got my shot from the CVS, and I asked the pharmacy, "Do y'all not ask that question no more?" His
Mm-hmm.
response to me was that because of the new type of vaccine that's been manufactured, the components and ingredients that once used to be put in the vaccine that people was allergic to the eggs, it's no longer being used.
Oh, that's great. That's great. I was a flu vaccine nurse, and that was a question all the time that we had to ask. And if they had it, then it was another. We couldn't provide it. They would have to go to the doctor. Yes,
And now, can I add something to that as well?
absolutely.
Mrs. Kent, Nurse Floor said it perfectly, because um, what they found is that the content of egg in the flu vaccines is so small now that even if someone had a severe reaction to eggs, that content, the amount of egg protein in some of the flu vaccines is so tiny that the risk of a severe reaction is extremely low. So they took away that precaution. Now, even if you have an egg allergy, you can get your flu vaccine at your doctor's office or pharmacist. And just like Nurse Floyd said, there are newer formulations of flu vaccines now that are not based on eggs. So just
Mhm.
wanted to add that as well.
Thank you for that. Thank you for that. And also COVID and RSV. What's the latest information about those vaccines, I'm sorry, Dr. Beysolow.
No problem. So when we switch our attention to COVID vaccines, everyone's hearing about the new updated COVID vaccine. What is it? What does that mean? Should I get it? So we wanted to answer some of those questions. So what is it? Truly, it's the same vaccine. We've had this mRNA vaccine made by, you've heard of the Moderna and Pfizer vaccines. We've had them now for several years. And this one has been updated to match the strains of COVID virus that are circulating in the air around us. So if you think about it, just like the flu vaccine, every year there's a new flu vaccine. Not because the one the year before wasn't any good, but it will probably not give you protection because the strain of the flu virus has changed. Same thing we're finding with COVID. You hear about all the variants. Now we're on the KP variant, right? And so every year, CDC and the FDA look at, okay, these are the viruses that are circulating. Let's make sure that the vaccine that's put out there can protect against these viruses. So that's why we have an updated COVID vaccine. So the answer to your question is yes, please get it now. The vaccine you had in 2020 or 2021, that COVID vaccine is not going to work for you anymore. Even if you had COVID disease last year, that protection has worn off. So
Okay.
believe me, there are many of us who've had COVID 2, 3 times. It is not any fun. Make sure you're up to date on your COVID vaccine. Get the new one, the updated one. If it's been more than 2 months since you got the last one, get it now. If
Mm-hmm.
it's been less than 2 months since you got that older version, when I say the last one, meaning the 2023 version, talk to your healthcare provider. They want you to wait at least 2 months, But for some people, if your immune systems are weak, they may say, we want you to get it, in 4 weeks. So, and that's the time interval between the old version, 2023, 2024, and the current version. And I always ask when I went to the pharmacy to get mine, I said, can you show me the vial? I want to make sure this is the right one. Is to say 2024, 2025, and the pharmacist said yes. So make sure you get the right COVID vaccine when you go in.
Absolutely. You got to advocate for yourself. Things happen. And
Yeah.
RSV, what about that vaccine?
So, with RSV, one of the things is I think we need to make sure everyone kind of knows about RSV, what it is, how it can affect different populations in our communities. So we always think about babies sometimes when we think of RSV. RSV stands for respiratory syncytial virus. It's a germ just like flu and COVID. For most of us, it just leads to a head cold. We may have sniffles, congestion, and a cough for a few days, and we get better. But for some babies, for example, it can make them very sick. They start wheezing, coughing, develop something called bronchiolitis, almost like they're having an asthma attack. And some of these babies, even healthy babies, end up in the hospital from RSV every year. It's actually the number one cause of hospitalization in infants in the U.S. RSV. So we want to bring attention to that because there are methods to help prevent this. And we'll talk about that in a minute. But RSV can also affect our older adults in our communities. It can be dangerous for adults, especially adults who are 75 and older. They have chronic lung disease, weakened immune system, or live in nursing homes or long care facilities. Because they're in more crowded conditions, they're more likely than to come in contact with RSV. And it can cause them to be in the hospital. It can also cause them to have to be on the ventilator, just like we see with some of the babies. But there are ways that we can prevent those. And I'm sure later on you'll be asking us about, the vaccines. And so I'll stop there. I just want to kind of give you an overview of RSV.
Well, thank you for that. I think that is important. I know that, we see the commercials and it would say, is your RSV vaccine up to date if you're going to go visit a baby or anything like that? So this is the reason why. How about any myths and facts? I know they're circulating, it's been there for years, different myths regarding vaccines. Vaccines are made to protect us. However, in the public sector, laymen, people have injected different thoughts about vaccines. And unfortunately, it's led us to be divided. So if you could just talk to us about myths versus facts so that we can be better prepared. And I'll ask Dr. Beysolow, and if anybody else wants to chime in, please do.
Well, I won't steal the show. Go ahead, Nurse Jallah and Nurse Floyd. Go right ahead. What are some of the things that you're hearing?
There was a young lady that I know was very afraid of getting vaccines for her infant because her fiance was scared because he received a lot of information about what causes certain things. I personally talked to her. And at this moment, they did. They went on and got the baby vaccines, and the child is doing fine. And it made the father a believer. But people still have a myth that it's going to cause paralysis. It's going to cause the person to grow up with their mind not right. I have heard it all. I wish people would not think that way. Then you still got certain religions that's not going to receive vaccines. And it's nothing that we can do on a case like that. Been a former public health nurse, and we had to go into the school system to make sure children had shots. We just got them to sign a declaration stating that people will not be responsible if something should happen to the child while the child was in school. And there was a lot of parents are willing to sign that form. So,
coming in from what Nurse Fleur said, so you have persons speaking about vaccine causing sterility, where some might say, I will not be able to have children because I received this vaccine. And of course, you'll hear some people who are sick, some patients who are sick will claim that, okay, well, I received the vaccine. And even you see healthcare professionals speaking, I received the vaccine and I was very sick and I'm not going to take it anymore. And also encouraging their family members not to take the vaccine. But I think as healthcare providers, we need to just give the right messages, encourage them to take the vaccines. We cannot force them to take them. Just have the right information, correct information, provide that information to them and let them make their decisions. And it comes even as ministers of the gospels in the faith-based organization, where your parishioners have to see you as the leader taking those vaccines for them to believe that those vaccines are it's important to be taken. So all we can do on our end, when we listen to the myth, bring the correct information to them, give them that information, and let them make their own decisions. And whether they want to receive the vaccines or not, give them all the proof, and then let them make that choice if they want to receive the vaccines. But the myths are still going around, and so we just need to just keep empowering them with the right information.
Thank
Exactly.
you. How about when people talk about herd immunity? Like if everybody else gets vaccinated, then I don't have to get vaccinated. How dangerous is that thought pattern?
Yeah, that's one we hear sometimes, and it is dangerous because herd immunity works when really, really high levels of the population are vaccinated. But when we start getting down to less than 90% being vaccinated against a particular disease, like we have now with, say, COVID or even with flu, we've never hit a time when more than 90% of people got their flu vaccine, right? So because of that, we don't have herd immunity. People think we do, but we don't have herd immunity. So you're still at risk. Even for childhood diseases like whooping cough, we're still seeing outbreaks of whooping cough across the US because a lot of people stopped vaccinating even during the pandemic. Initially, people were scared to go out. We understand that. But now this fear about vaccines has transferred not only from COVID vaccine, but to other vaccines that people would normally get. People are just really afraid. And just like both Nurse Floyd and Reverend Jallah say, you have to have those one-on-one conversations. If you're meeting someone, and reassure them that vaccines have been around for a long time, they are safe. Getting the disease the natural way is not always the best way, because I hear that also is not safe. You don't want to come down with measles. It could lead to your child being deaf. It could lead to the child dying. So these are diseases that luckily we don't see anymore thanks to vaccines.
Understood. Understood. And how would we set up a vaccine clinic as health professionals and as ministers of health? How would we do that for our congregations? Nurse Floyd, do you have anything to add on that?
Yes. We recently just had our first checkup meeting in our Episcopal District in the local area where I live. And I thought, well, at the time, what can I do to reach the community? So I called the local health department in that area. And at the time, they had already had a lot of vaccines events that weekend. But what this nurse did, she partnered with small pharmacies. So she reached out to a local pharmacy near the church. That pharmacy agreed to come to the church. And I was able to set up a vaccine clinic. And it was very successful. And our bishop made a believer of all of them. He received the vaccine. And it's very funny because after he received his vaccine, other parishioners want to get their shot. I thought that was funny, but it was very successful. And I'm hoping to be more active in the community once we come together with large gathering and continue having vaccine clinics.
Awesome, awesome. And if we do everything that you said, Reverend Jallah said to mask up, wash your hands, Dr. Beysolow said we got to get vaccinated. Nurse Floyd set the vaccination clinic up, and you still get sick. What are some of the things that we need to do in our community to advocate and promote for vaccines? Because some people will see, all right, this one got vaccinated, she still got sick, so I'm still not a believer. what are some things that we can do?
So I'll say on my end, I piggybacking on what Nurse Floyd just stated about her church hosting a vaccine clinic. We'll be surprised to know that a lot of the pharmacists are pushing to come to faith-based organization to immunize the parishioners. And so we who are in the public health field, or even if we are not in the public health field, if we have a church, we can contact those pharmacists and ask if they will come in to vaccinate members. So, and right here at Shaw, we are in a conference, and we were fortunate to have Walgreens who agreed to come in here for 3 days. They were here today, the first day. We didn't get any participants for today, but we know tomorrow is missionary night. So we anticipating to have more people. And as the day has gone on, I've been talking to persons and saying, you need to get vaccinated. I've gone in the kitchen. I've gone to the daycare area. And some of the people are saying they don't want to get sick. I said, well, it's going to be the weekend. Take some Tylenol and come and get vaccinated. You're taking care of children. Children, of course, carry a lot of germs. And you don't want to be sick taking care of those children. So I think we just have to keep promoting it. They need to see us take those vaccines. If they get sick, one of the things we need to remind them of, the vaccine doesn't stop you from getting sick, but it helps you that if you are infected by the flu or COVID-19, your symptoms will not be as severe as when you were not vaccinated. Also, it will prevent you from going to the hospital. So we see most of the time in the hospitals where people are so sick, they have so much, it's just horrible. And then they start saying, I wish I had taken the vaccines. But if they had taken those vaccines, the symptoms would not have been as severe as it is during that time that they are hospitalized. So I will continue to say, as public health consultants, as public health nurses, as faith-based organization, we just need to keep encouraging. We need to keep talking about it. And of course, we have a history with vaccines, so we know where it stems from. And I'll say, growing up, just coming back, Dr. Beysolow is aware that we did not even get authorization. Our parents didn't get authorization for us to be immunized. They walk into the schools, and the first thing they said, the people are here from the United States, and next thing to give us vaccine. And they were just popping us, and the kids were running, and there was no cleaning, no sterilization. Kind of clean the site before they gave the vaccines. They were using one gun, and that gun was just shooting everyone. So we know if God has kept us this far, He will continue to protect us. So He's giving us the tool. We need to just make sure that we keep empowering our people, not only with the word of God, but also to be healthy. Because if our bodies are not healthy, our temples are not healthy, we cannot do the work that He's called us to do.
Amen.
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 Just add on to what Nurse Jallah was saying too. Education is so important, and I know the hospital of the church is sometimes looked at as a hospital. And we got to just continue letting our medical personnel people in the churches keep teaching them to encourage them to continue teaching the parishioners about certain conditions. We got to continue partnering with the pharmacists because, like Nurse Jallah saying, and just like the pharmacist told me, they're glad to partner with churches. They're glad to come out to events. And I'm so glad that they have given Dr. Beysolow the title of being the health director. And then it's broken down to the health suite nurses, sacred, health coordinators. We are going to have to get out and just reach other nurses that's in the congregation to continually teach and educate, because the public health concept, I know, is still there, but it's not like it used to be. So it's going to have to be up to us to continue reaching out and teaching and giving out information as needed to members.
Absolutely. Absolutely. And I love that, we are now making it very easy to get it.
Yes.
You just come to church and Walgreens is there, so I can get my shot. It doesn't have to take a big, appointment, transportation, different things, out of your schedule to get vaccinated. Because then those are the excuses that people will use. And, I didn't get vaccinated. And, we don't need that. We need it to be as simple to access, just easy, go get it, be protected, so that we can all be protected for the season. So that's awesome. Dr. Beysolow, if we do get sick, what are some of your suggestions? What's your advice? If we do come down with the flu, as we discussed, it can still happen. Come down with COVID, it can still happen. Same thing with RSV. What are some of your what's some of your direction as to how we can treat ourselves so we can get better?
Excellent, excellent. And I mean, I think both Nurse Jallah and Nurse Floyd really laid it out and hopefully took care of those myths that the vaccine is causing you to get sick. The vaccine is not the reason why you're getting sick, right? So just a little bit about how vaccines work. When you give someone a vaccine, their body sees it as something foreign. It shouldn't be there. And your body tries to get rid of it. So by doing so, your body makes something called antibodies or fighting cells to kind of fight off what it thinks is invading its body. During that process, as your immune system is making those antibodies, you may have a fever. You may have a sore arm. That's part of your immune system working. Most of us will have those symptoms. Some people may not, but that doesn't mean you came down with the flu or you came down with COVID after getting the vaccine. That's just signs of your immune system working. So we want to be sure that those symptoms, people know they can take care of that with either Tylenol or ibuprofen, but they have to ask their healthcare provider. Some people have medical conditions where they may not be able to take Tylenol or ibuprofen, but if the healthcare provider says, yes, you can, those will help take care of those symptoms. But probably what you're asking me is, what if someone comes down with the actual flu or COVID? What are some things they can do? So there are medicines called antivirals, and flu is a virus. Taking an antibiotic will not treat the flu. So if you have some old amoxicillin in your closet or in your refrigerator, don't even try to take that. That's not going to help you with the flu. Okay. So antivirals, for example, you may have heard of one called Tamiflu. It won't get rid of the flu altogether, but it will make your illness a lot milder, and it will shorten how long you're sick. So instead of being sick and laid out in bed for 7-8 days, you may only be sick for 2 or 3 days if you start that Tamiflu. But you have to start it early. So we always advise people, especially this season, especially if you have chronic medical conditions, you know you can get sick very quickly because of your underlying immune system. If you come down with symptoms, get tested. Don't get worse sitting at home, because there are medications not only to treat the flu, but there are also medications to treat COVID. There's one called Paxlovid. Some of you may have heard of that. And then for some people who are sick enough to be in the hospital, Paxlovid is given by mouth. So it's a prescription that you would get just like you get a prescription for Tamiflu. For the flu, you can get a prescription for Paxlovid if you meet certain criteria. If you end up in the hospital, they can give you an IV as well to treat COVID. So there are treatments. We want our people to be aware, to be armed with all of these tools. Like Reverend Jallah said, you have all these tools at your disposal. Like Nurse Floyd said, those of us who are in public health and healthcare need to continue to share this information with our congregations and let them know there are options. And wanted to just kind of piggyback on something we said earlier about the different symptoms. So maybe one of the nurses could help us out here when we talk about just that difference between flu, COVID, RSV.
Okay, so if you have the flu, some of the signs and symptoms you have is your body starts to ache. You feel like you've been hit by a truck. You might have some runny nose. Sometimes you might not. You might have fever. Some people have fever. Some people won't have fever. But basically, you will be so exhausted, fatigue. You find fatigue, fever, and body aches. That's one of the main things when you have flu. Those are some of the signs and symptoms you will have. Sometimes you might have some headache. That headache would be so severe you can't handle it, but sometimes you might not have headache for flu. With COVID, if you start to experience COVID, you have aches, you fatigue, you have fever, you have loss of appetite, loss of your smell. You sometimes will have sore throat. And for persons who are asthmatic or has any respiratory disease, they might start wheezing. You might have, where some people might have some bronchitis, but you will have a lot of chest congestions with that. Ms. Floyd, you want to come in?
Yes, the RSV, that one is really sort of tricky, but it needs to get diagnosed again by the physician. Don't ever think you got one versus the other. Make sure you get the diagnosis from your physician. But one thing about the RSV, that difficult breathing and that fever, those two symptoms are really intense with someone with RSV. And I'm sort of thinking about, on a personal note, when my grandchild was born, she caught RSV when she was 4 months old. And at the time, she'll be 18 in about 3 more weeks. But back in the 2007, they didn't have all of this new methods of oxygen. And at the time, and Dr. Beysolow probably can identify what I'm getting ready to say, they had the big tents, and you had to
That's right.
whole crib in a oxygen tent.
That's right.
We almost lost our baby 3 different times. She was in the hospital for a total of 3 weeks. What really got her cured was high doses of steroids, but it burned the inside of her intestines, and she had to be followed with a pediatrician for the first 8 years of her life, and it finally healed. But difficult breathing and fever, even I've seen that in adults. Those are 2 symptoms that when you see somebody with those 2 symptoms, and once the doctor have established that's the culprit, which is the RSV virus, is they're really sick.
Wow, thank you for even sharing that personal story, Nurse Floyd. And we failed to mention just how you can protect against RSV, right? For the babies, there are 2 ways. When the mom's pregnant, they can get a RSV vaccine towards the end of the pregnancy, and those antibodies, those fighting cells that the mom's built up, then transfers to the baby. So that's one way. Another way is if the mom didn't get vaccinated, then the baby under 8 months old can get what's called ready-made antibodies or fighting cells. It's not a vaccine. It's still a shot, but it's not a vaccine. It's just a shot containing these ready-made fighting cells called nirsevimab, and the baby can also get that. We try to do this during the winter season. So if you have pregnant people in your congregation, young pregnant moms, people with infants under 8 months old, talk to them about RSV protection, because just like Nurse Floyd said, you do not want your baby to end up in the hospital with RSV. There's also vaccine for adults as well, the RSV vaccine for adults. Like Nurse Floyd said, the older adults can also come down with RSV, and there are 3 different vaccines recommended for adults to prevent RSV.
Yeah, Dr. Beysolow, I have a question on
Sure.
the RSV for the pregnant woman. The doctors, are they making that mandatory for all pregnant women to get that at 32 to 36 weeks, or is that an option where the mother decide herself that she's wanting to take that shot?
That's such a great question. It's an option, but really just what both you and Nurse Jallah said, we have to make our congregation aware that they can ask for it. Because one of the reasons a lot of these vaccines are not being administered into arms is because doctors are not recommending them. Either they're too busy when you're there for a visit, they're concentrating on so many other things, they may forget. You have to advocate for yourself. You have to go in armed and say, hey, am I not due for a vaccine today? Hey, I heard about this RSV, how it can affect babies. Should I not be getting this today? So excellent question. Thank you.
Can I say something?
Absolutely. Go ahead.
Okay. I also want to add that parents who have their children in college want to also encourage those children to receive their flu vaccines, because most of them who stay in the dorm, they use the same bathroom, they in crowded spaces. And I find that most of the time when students go off to college, they forget about receiving their physicals, they forget about going to the dentist. And so we who have children that are in college, we need to stay on top of that, because those children are still covered under our insurance. so they can still make sure that the children are going, the young adults, let me use the right terminology, the young adults are going to receive the annual physical, that they are receiving those vaccines, flu vaccine, HPV vaccines, that they are being immunized, and they are going for the dental visits, and even for the ophthalmologist appointment. And I think most of the time it is forgotten. So that's one thing we also want to bring to the forefront, to encourage our parishioners to make sure that the collegiate students are taken advantage of.
Absolutely. Very good point. Very good point. And speaking of that, you do have your young adults in college. If they do get sick, I don't even know if we still do care packages. When I was in college, care packages were a big deal. So what would be some natural remedies that you could offer or suggest if your young adult does get sick? Natural remedies, or even other medications that you feel that are important to use during this time. And I would ask Nurse Jallah, then Nurse Floyd, Dr. Beysolow, if you have anything else to add.
Well, I know when my young adults went off to college, even though they know I'm a nurse. So in the house, we had a medication basket where we had Tylenol, we had ibuprofen, we had cough medicine, cold medicine. So they all knew how to go to the baskets to get medicine, laxative, and everything was in there. So when they were off to college, I packed those items in the care packages to take with them. And I made sure to tell them, if this is expiring, make sure that you go ahead and get another bottle. And so they were always packaged with all those medicine in the box. And of course, their friends would come to them, and they were sitting there acting like doctors. I give you an example. My son called me, they traveled. So he called me, oh, his friend legs are swollen. I said, okay, you guys went off to Germany. Was he drinking water? No, he was drinking Powerade. Okay. Was he eating anything salty? So I went down the list. Is it swollen? Is it painful? And of course, thank God it wasn't any blood clots, so he was able to drink and rest and keep. Well, yesterday got another call. They were playing basketball, hit one person in the face, and he's calling me. And I said, okay. Now he said, we put some ice on it. I said, okay. He should go home. The nose not broken. I said, no. Do not go to an urgent care. Urgent care does not have X-ray machine. Take him to the ER. So they went to the ER, and I said, you got to go to the ER. Let them go ahead and take an X-ray of his face. Of course, the nose was broken. Thank God he followed that instruction. They were able to get him. And then, of course, they want to do a CT. He calls me. Do they need to do a CT? I say, yes, because you don't know what shifted when you hit his face. So let's get that CT done. I said, because you guys are in California. The young men parents are in Washington. That's a long distance. So just make sure, so we want to make sure that our children have those Tylenol, the Motrin, especially for our young ladies who have the cycles. Some of them take Midol, some of them take Tylenol, whatever they take, make sure that they have that little care package in there so that they can take with them. And when they come back, make sure that you're refilling it. And you're also doing your job as a parent to educate them and ask some advice from the doctors when they do their visits.
Yeah, I like that idea about the care packages. I like that.
Yes. And I'll also say for the younger kids, those are my babies now. So got to be careful with our younger kids with these over-the-counter medications. As a pediatrician, we truly did not recommend a lot of over-the-counter medications because they can sometimes do more harm for the babies under 5. If that child is coughing a lot, you want to talk to their provider, let them listen to their lungs, make sure they're not wheezing, make sure it's nothing else like a pneumonia or something else before you give a lot of cough suppressants to our very young kids, because that can keep the mucus in their chest, as we say, and can make things worse. For the older kids, ones going off to college, or young adults, like Reverend Jallah said, that's a different story. But for the really young kids, you want to be really careful there. Sometimes if they're in that age group where it's safe for them to have honey lemon cough drops, say after the age of, say, 10 or 12, then that's something you could do. You just want to be careful for choking. Make sure that it's small pieces where they cannot choke on it. Or if they're old enough to drink hot tea, if you put some honey, lemon, and ginger in a tea as a natural remedy, those are all great to use. Vaporizers, I know they sell them in Target, Walmart. things that can help them breathe a little better, or humidifiers at night when they're really stuffy to help them breathe better. So those are all some of the more natural things that we would recommend.
Yes, thank you for that. Thank you for that. Nurse Floyd, do you have anything else to add? Any home remedies?
Well, and like Dr. Beysolow was saying, especially with young mothers, we just got to let them know after you try those remedies, at least for the first 24, 48 hours, and if the child is not getting any better, definitely take that child to the emergency room.
Yes, absolutely. Absolutely.
Yes.
And we also not forget the pregnant women too.
Yeah.
Mm-hmm. Right,
Yeah.
right. Right, all
Don't
things.
feel well. Yes.
You got to surrender and get to that hospital if you
Yes.
need. Mm-hmm.
Exactly.
Absolutely. Well, as we wrap up, I'll ask you ladies, do you have any closing remarks? This has been a very informative discussion with everyone's input. I think that, if everyone is watching and listening, we can have a better season. We don't always have to get sick, right? We can protect ourselves. We can make sure that we're well guarded. And if we are, we do get sick, we can take some of the notes and information that we've received at this discussion so we can be better. Any final?
Yeah, Nurse Ken, I would just like to say that I would just like to encourage people, don't forget the mask. I mean, anytime that they're in large groups, keep masks in your pocketbooks, put them on. We just recently got out of leadership training, and I noticed people was going into their pocketbooks, pulling out their masks, and that's wonderful. But I would advise anytime if you're going off and you're going to be exposed to a large group of people, do social distancing and put the mask on.
Yes. Mm-hmm.
Exactly. Say as we move into the holiday season, just like you said, Nurse Floyd, we're pretty soon it's going to be Thanksgiving. We're all going to be gathering around in close spaces. Make sure, number one, you get your vaccine now. It takes about 2 weeks for a vaccine to start showing protection. So you can't get your vaccine today and expect for it to work tomorrow. That's not going to happen. So you want to make sure that you get vaccinated now so you're ready for Thanksgiving and Christmas holidays with your family. That way you're protecting not only yourself, but the ones in your family who are either too young to get vaccinated, those babies under 6 months, or our older adults whose immune systems are not as strong. You want to help protect them as well. So get vaccinated, wear your mask, especially if you go into conferences, these national conferences that we're having, like Nurse Floyd said. Don't shy away just because everyone else is not wearing their mask. If you know you have a chronic medical condition, wear your mask. Don't get sick unnecessarily because you for some reason felt, oh, I don't need to wear my mask. So please wear those masks.
Mm-hmm.
I want to say thank you to the Board of Bishops for this wonderful position, Director of Health Ministry, for Dr. Beysolow, because it has really opened our eyes to making sure our people are healthy. We have this in the different race churches, and they have grown it so well. And yet we are just entering into this area, but we are so excited to have this ministry and this platform, and to Mr. Kent and to you, Mrs. Kent, for sitting on this panel this evening. It's just been a blessing, and just want to encourage all our presiding elders, our pastors, our bishop. Let's make health our priority. We want to live longer. We want to do the work God has called us to. And if our temper is not in order, physically, mentally, emotionally, and then of course financially, but most especially mentally and physically, we cannot do this work. And we have our younger generation coming behind us. We need to be the example. We need to be that light to teach them and show them, and just watch what we're bringing into the church to feed us. So thank you for this great opportunity.
Thank you, ladies.
Thank you, Dr. Beysolow. Thank you.
Thank Nurse Floyd, Nurse Jallah, and Mrs. Ken. Thank you so much. And spoiler alert, she's also a healthcare professional. And one of these days soon, she'll be on the other side of the mic, and we'll be asking her questions. So we want to thank her for just stepping up and taking on this opportunity, and also to Brother Kent. Just always thank you for allowing us to bring health to the forefront. Thank you.
Yes, thank you. You ladies have a wonderful night. Stay safe and we will speak again.